Disclaimer: this podcast is for educational purposes only and is not medical advice. Always consult a qualified healthcare provider before starting or changing any treatment, supplement, or peptide therapy. The information shared is based on research, general knowledge, and discussion, but your individual health needs may be different. Today we are diving into the peptide called Liraglutide. Liraglutide is a glucagon-like peptide-1 receptor agonist, also called a GLP-1 analog. It was originally developed for type 2 diabetes management, but has since been widely studied and prescribed for weight loss, appetite regulation, and even potential cardiovascular protection. You may know it by brand names like Victoza or Saxenda, depending on whether it is being marketed for diabetes or for weight management. Liraglutide works by mimicking the actions of natural GLP-1 in the body. GLP-1 is an incretin hormone, meaning it is released from the gut after eating and helps regulate insulin secretion, slows gastric emptying, and reduces appetite. When you inject liraglutide, it binds to GLP-1 receptors in the pancreas, brain, and gut, leading to improved blood sugar control and a sense of fullness that can help reduce food intake. Because it has a longer half-life than the body's natural GLP-1, liraglutide only needs to be injected once daily. One of the main reasons liraglutide has become popular is its effect on weight loss. Clinical trials have shown that people using liraglutide along with a reduced calorie diet and exercise often lose more weight compared to placebo. The mechanism is tied to appetite suppression, delayed gastric emptying, and better regulation of hunger signals in the brain. Many people report that food cravings decrease and portion sizes become easier to control. Beyond weight loss, liraglutide has important implications for people with type 2 diabetes. It helps the pancreas release insulin when blood sugar levels are high, and it reduces the release of glucagon, which is a hormone that raises blood sugar. Together, these actions smooth out spikes in blood glucose after meals and help reduce long-term complications from high blood sugar. Some studies even show cardiovascular benefits, including reduced risk of heart attack and stroke in high-risk individuals. Of course, like any peptide or medication, liraglutide comes with potential side effects. The most common are gastrointestinal, including nausea, vomiting, diarrhea, and constipation. These effects are usually dose-dependent and often improve after the first few weeks. Because liraglutide slows stomach emptying, some people experience early satiety, which is the desired effect for weight management, but in others it can feel uncomfortable. Rare but serious risks include pancreatitis, gallbladder disease, and possible thyroid C-cell tumors, which is why it is contraindicated in people with a history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2. Dosing usually starts low and is gradually titrated up to reduce side effects. For diabetes, typical daily doses are between 1.2 and 1.8 milligrams, while for weight loss, doses may go up to 3 milligrams daily. It is injected subcutaneously into areas like the abdomen, thigh, or upper arm. Rotation of injection sites is recommended to avoid irritation or lumps under the skin. One of the key points about liraglutide is that it is not a quick fix. It works best as part of a long-term strategy that includes diet and lifestyle changes. When people stop using it, weight regain can happen if those habits are not in place. That is why medical supervision and a comprehensive approach are so important. There has been growing interest in comparing liraglutide to other GLP-1 receptor agonists, such as semaglutide, dulaglutide, and exenatide. While semaglutide is more potent and has a weekly injection option, liraglutide remains an important choice, especially for those who do not tolerate other GLP-1s or prefer a daily routine. It also has a long track record of safety data, which gives clinicians confidence when prescribing it. In addition to weight and glucose control, researchers are exploring other potential benefits of liraglutide. Some studies suggest it may improve fatty liver disease, also known as non-alcoholic steatohepatitis. There is also interest in its effects on neuroprotection, as GLP-1 receptors are found in the brain and may influence memory and cognition. While these areas are still being studied, it shows the wide-ranging potential of this peptide beyond its original purpose. Another interesting aspect is patient experience. Many people report that liraglutide helps them feel more in control of food choices. Instead of battling constant cravings, they feel satisfied with smaller meals and less drawn to unhealthy snacks. This psychological relief can be just as important as the physical effects. However, others find the side effects intolerable or struggle with the cost, as liraglutide can be expensive without insurance coverage. Because it is a peptide drug, liraglutide must be stored properly. It comes in pre-filled pens that need refrigeration until the first use, and then they can typically be kept at room temperature for a set period, depending on manufacturer instructions. Each pen delivers multiple doses and has a dial to set the correct amount. Patients are usually trained on injection technique before starting therapy. Let's take a deeper look at the science. GLP-1 acts through both peripheral and central mechanisms. In the pancreas, it enhances glucose-dependent insulin secretion, meaning it only boosts insulin release when glucose is elevated, which reduces the risk of hypoglycemia compared to other diabetes drugs. In the brain, GLP-1 receptor activation influences satiety centers in the hypothalamus, helping reduce hunger signals. In the stomach, it slows emptying, which prolongs the sense of fullness after a meal. These combined effects make liraglutide uniquely effective for both diabetes and weight management. In terms of safety, long-term trials such as the LEADER study provided reassurance that liraglutide not only reduces cardiovascular risk, but also lowers all-cause mortality in patients with type 2 diabetes. This has positioned it as more than just a glucose-lowering drug, but as a therapy that may extend life expectancy in high-risk individuals. That is a powerful finding and one reason why liraglutide remains widely prescribed even as newer peptides become available. It is worth noting that liraglutide is not approved for type 1 diabetes, and it should not be used in people with a history of pancreatitis unless cleared by a physician. Alcohol and high-fat diets may increase the risk of side effects, so lifestyle counseling often goes hand in hand with prescribing this medication. For those considering liraglutide, the decision often comes down to weighing the benefits of improved blood sugar and weight control against the potential side effects and cost. Many find that the positives outweigh the negatives, especially with careful monitoring and medical guidance. Looking ahead, the future of GLP-1 therapies, including liraglutide, is very promising. Researchers are even studying combinations of GLP-1 receptor agonists with other incretin-based drugs, such as GIP receptor agonists, to enhance weight loss and metabolic outcomes. This could mean more effective therapies in the near future, building on the foundation that liraglutide helped establish. If you are curious about this peptide, remember that education is key. Understanding how it works, what it does, and what to expect can make the journey smoother. Whether the goal is weight loss, better blood sugar control, or improved cardiovascular health, liraglutide has a solid role supported by years of research. Disclaimer: this podcast is for educational purposes only and is not medical advice. Always consult a qualified healthcare provider before starting or changing any treatment, supplement, or peptide therapy. Thanks for listening, keep learning, and stay curious.